to this virtual press conference on COVID-19 in the WHO Western Pacific region. My name is Olivia Law-Davies. I'm the Regional Communications Manager for WHO here in the Western Pacific. And I'm delighted to be joined, as usual, by Dr. Takeshi Kasai, WHO Regional Director for the Western Pacific. And we're also happy to be joined by as usual, by Dr. Takeshi Kasai, Dr. Tamano Matsui, Program Area Manager for Health Emergency Information and Risk Assessment, and Dr. Socorro Escalante, Coordinator for Essential Medicines and Health Technologies. We're going to begin the session today, as usual, with a few opening remarks by Dr. Kasai. Please go ahead.
Good morning. We're 7.5 months into COVID-19 pandemic, and sadly, infections and deaths are accelerating in many parts of the world. There are now more than 21.5 million confirmed cases, and over 760,000 people have died. Each one an individual tragedy for their family and community. In our region, with the number of cases reported has been much smaller than other parts of the world. Each country is facing a different situation. And some countries that moved quickly to contain COVID-19 in the early months of the epidemic are now fighting new surges, in some cases larger than their initial outbreaks. I'll ask my colleague, Dr. Tamano Matsui, to provide an update on the key numbers in the region. Tamano, please.
Thank you, Dr. Kasai. Good morning. My name is Tamano Matsui. I would like to summarize the current trend in COVID-19 for the Western Pacific region. To date, more than 400,000 cases have been reported in the region, and 9,293 have lost their lives to COVID-19, which represent 2.3% of all reported cases. The slide shows the trend in the number of reported cases of COVID-19 for countries and areas in the Western Pacific region from January until now. The vertical axis displays the number of daily cases, and the horizontal axis displays date of report. The colored bar represents the countries reporting those case numbers. As you can see, the early period of the pandemic in the region was characterized by a large outbreak in Hubei province, China, which was brought under control. After that, we saw reports of clusters outside of China and then increasing levels of community transmission. Recently, we have observed increases in the level of community transmission in some countries, and early detection and response to large clusters in other countries. These patterns indicate that we are entering into a new phase of epidemic and response. This slide, next please. Okay. This slide shows the trends in reported cases for countries and areas that have reported fewer than 5,000 cases. Most of these cases were imported, though some community transmission occurred, such as in New Zealand. After many months of seeing only imported cases in these countries, increase of community transmission and outbreaks have been observed in some of them, and this is also a reflection of improved response. If we look more closely at the countries, we can broadly categorize them into 4 groups. The first contains countries which cases are on the rise, such as Papua New Guinea and Philippines. The second contains countries in which cases came down and are again on the rise, such as Australia, Japan, and Vietnam. The third contains countries where community transmission has never been detected, so cases are only imported, such as Laos and Mongolia. And the fourth countries contained in which no cases have ever been reported, such as several Pacific Island countries and areas. Although those most vulnerable to severe disease and death tend to be older, the virus has impacted young people substantially, especially in the most recent period. For example, in the Philippines and in Victoria, Australia, more than half of the reported cases are people under 40 years. The same is true in Japan, where 65% of infections reported from July to August are among people aged 39 and below. This is particularly concerning as these age groups are more likely to have mild or even no symptoms, so they can transmit the virus in vulnerable settings such as aged care facilities and correctional facilities without knowing it. Thank you. Back to Dr. Kasai.
Thank you, Tamano. What we are observing is not simply a resurgence. We believe it's a signal that we've entered a new phase of the pandemic in the Asia Pacific. In this phase, countries are increasingly able to minimize large-scale disruptions to people's lives and economies by combining early detection and rapid response to emerging infections and people sticking to the prevention measures that are part of the new normal. The directions that epidemic now takes depends on the actions of government and people across the region. Over the past month, with experts from across the region, we have taken stock of the response, which has been guided by the Asia Pacific Strategy for Emerging Diseases and Public Health Emergency, or APSET. We saw three lessons emerging. First, the significant investment in health emergency preparedness made over several years in the region have paid off. Countries have put to use the capacities and mechanisms built up over the years through APSET implementations to respond quickly. This is one of the reasons why this region has comparatively low COVID-19 figures today. To prepare for the future, we need investment. Second, while countries have much stronger capacity than they would have otherwise had, the sheer size of this pandemic is greater than we had imagined and more than we had prepared for. And we've realized that countries' preparedness and response capacity need to be scalable, so they can get much bigger or smaller and more targeted as needed. And third, we must continue to refine, learn, and adjust our response in pursuit of the new normal, because COVID-19 will likely be with us for the foreseeable future. Some of these refinements include a greater targeting and earlier introduction of localized movement control measures and public health interventions. Approaches like this could be more effective and minimize social disruptions and impact on economies. We also have to continue to strengthen the capacity of health system and public health to identify cases, isolate and treat them, and also trace and quarantine their contact. And now we must plan and act to protect the vulnerable. And most importantly, we have to continue encouraging everyone to maintain the behaviors that protect their health and that of their family members, colleagues, and community. As my colleague reported, the epidemic is changing. People in their 20s, 30s, and 40s are increasingly driving its spread. Many are unaware they're infected with very mild symptoms or none at all. This can result in them unknowingly passing on the virus to others. This increases the risk of spillovers to the most vulnerable, the elderly, the sick, people in long-term care, people who live in densely populated urban areas and underserved rural areas. We must redouble efforts to stop the virus from moving into vulnerable communities. We are encouraged to see many countries in this region already adopting new tactics that help minimize the social and economic consequences of COVID-19 and show how we can cope with it for the foreseeable future. Many are now detecting outbreaks earlier and responding to them faster with more targeted intervention and an agile approach that brings back health, societies, and economies at the same time. Where rapid detection is coupled with the robust contact tracing, clusters of infections are being controlled, even when those clusters are relatively big. We also recognize that many countries have increased their capacity of their health system so that they can accommodate more patients and avoid the systems being overwhelmed and triggering the need for radical measures. And finally, in many countries, we've seen impressive changes in people's behavior with mask wearing, physical distancing, and hand hygiene now part of a daily life. We know it's not easy to keep this up and that many people are tired, but we need people to continue making positive choices, protect themselves and their community. But change is fragile and sometimes short-lived. Achieving and sustaining the new normal everywhere will continue to be a serious challenge as long as the virus is circulating and we don't have immunity to it. But we can all make an active choice for a way of life that is safe and allow us to work and study. If we make these choices, we can use more moderate control measures, avoiding blanket nationwide lockdown, extreme economic closures, and high rates of infection and death, and find a way to improve both health and the economy together. COVID-19 is not just happening to us. After 7 months of pandemic, we're starting to see a way to restore health, societies, and economy together. We cannot do one without the other. COVID-19 will be with us for the foreseeable future. We know it's a long and difficult stretch, and we will face setbacks. But we must keep trying, learning, and doing it together. How we fare is up to each and every one of us. If we make the right choice every day, we'll come out of this as safe and as strong as possible. Thank you.
Thank you so much, Dr. Kasai. We've now come to the point in the press conference where we will address questions. We received many great questions ahead of time by email. We'll try to get to as many as we can, and we will also do our best to accommodate any questions that come in via the live chat, but we appreciate your understanding that obviously time is limited, so we will do our best to get to a good selection. The first question today comes from Salma Khalik from the Straits Times. Places like Japan, Australia, the Republic of Korea, and Hong Kong were considered to have done well in controlling COVID-19 initially, but are now facing second waves of infection. What is the impact of these flare-ups on global efforts to get the pandemic under control? Dr. Kasai, could you speak to that one, please?
Yes, Liv. those countries are the countries continuously improving their capacity. As I mentioned in my opening remarks, we're entering the new phase in Asia Pacific. It is the phase where government will need to deal with the multiple increase or surge, but in the same time, in a sustainable way. There are 3 points in here. One is that we have to do more earlier targeted response so that we can avoid as much as possible the big disruption to the economy and people's life. The second is that we should continue to improve healthcare and then the public system. But in addition to that, we have to also now plan and act to protect the vulnerable. And then lastly, we've been repeated many times, but we have to really help people maintain their healthy behavior, not just protecting themselves, but their family, communities, and then the vulnerable, and business sectors to find a way to operate to minimize the risk. And these are the countries who's really these are the countries who have been improving their capacity, is really moving into that direction.
Thanks, Dr. Kasai. The next question we have is from Jason Gale at Bloomberg. Does the vulnerability of older people aged over 65 vary from one country in the region to the next? And if so, what factors lead to increased or decreased risk of infection or mortality in this older age group? Dr. Kasai, again.
Thank you, Liv. This is actually a very important question. It's about the question of the vulnerability of the older age people. Our regions, we have several member states who has a significantly older age group. It's not that easy to compare the country with the different background and different epidemiology. But what we see around the world is there's a tendency that the older people are more vulnerable to this COVID-19. And also, the data from our regions, Australia, Japan, and Korea, the age group above 80 is recording more than 20% of the fatality proportions. We also observe the informations around the world. For example, in Europe, 30 to 60% of the deaths are in the so-called long-term care facilities. And we do also have those long-term care facilities. For example, in China, age above 65, 2.2% people are in such a long-term care facility. Likewise, 4.4% in Korea and 5.9% in Japan. So it's very important for us to plan and act to prevent those viruses entering into those long-term care facilities. We have issued a guidance document and we've been upgrading them. The key in that document is how to prevent those viruses get into those facilities. And once it gets in, how to minimize the spread inside, and then eventually how to contain within it. And when we talk about also the elderly, we have to pay one more important attention to the one more important point. That is, while the social distancing is effective in controlling these diseases, we really have to pay attention to negative consequence of that, such as the impact to the cognitive capacity or mental and the physical capacity. So to work on this is going to be a very important area of work in this region.
Thanks, Dr. Kasai. The next question that we have is from NHK. Russia says it has a COVID-19 vaccine ready to go into production, and the Philippines has said it's ready to receive it. What is your opinion on the safety and effectiveness of Russia's so-called Sputnik vaccine? Dr. Escalante, could you respond to this one, please?
Thank you, Liv, for the question. WHO is aware of the ongoing discussion of Russia and the Philippines with regards to the sharing of vaccines to the Philippines. And we have information that these vaccines might be available by October in the Philippines. WHO welcomes all advances in COVID-19 vaccines research and development. However, we also continue to emphasize that accelerating vaccine research should be done following the steps to ensure that every step of the development will contribute to ensuring the safety and effectiveness of vaccines, and that all candidate vaccines that are going into production should adhere to the standards of safety and efficacy. WHO at the global level continues to coordinate and contact the scientists and experts, as well as the national regulatory authorities in Russia. And we hope to get the response in terms of the evidence of this new vaccine.
Thanks so much, Dr. Escalante. The next question we have is from Red Mendoza at the Manila Times. COVID-19 has brought on an infodemic of misleading, false, or unverifiable information, particularly with regard to treatments and cures. How does WHO in the Western Pacific ensure that health ministries have evidence-based information? And what are you doing to fight incorrect information that's circulating? Dr. Kasai, would you like to speak to this one?
Thank you very much, Liv. Actually, this is the area that your team is working so hard. I myself involved in the 2003 SARS response. And what I have experienced at that time and then today is so different. In 2003 SARS, people are getting information from newspaper or TV. But now people are accessing the information, many different sources, including social media. And not just accessing, but they can also forward those information. So fighting with the information that is not correct is now becoming a very important area of work. And what we are doing is, number one, we try to monitor and pick up if there is such a misinformation. And we ourselves also try to send the message, what we know and what we don't know. And we're doing this together with the tech partners. And we very much appreciate their contributions and commitment. This occurs, the same things occurs as also in the country level. And we, WHO, has a country office, and we have a staff in the country office working on the same things. And we're helping ministry basically doing the same things, but together with many other partners, not only the tech partners, but our partners in the UN agency and other bilateral partners, and then other partners on this issue.
Thanks so much, Dr. Kasai. The next question that we have now is from Jiali Tao with CCTV. What is your assessment of vaccine development and trials that are currently underway in China? Back to you, Dr. Escalante.
Thank you again, Liv. China has been one of the countries that has been actively undertaking research and development for vaccines for COVID-19. From the WHO monitoring, we see that there are 7 candidate vaccines from China that are advancing into a phase 2 and phase 3 clinical trial. WHO at the global level has been working with a number of research and development institutes across the world and guiding the conduct and providing protocol of the clinical trials for vaccines. And again, as we have just mentioned a while ago, we really welcome and appreciate the acceleration of the research and development. But at the same time, we would like to emphasize that all the steps for R&D and clinical trials should be followed to ensure safety and efficacy of all candidate vaccines.
Thank you. We have also a couple of questions covering some of the same themes. One from Jovic Yi with The Inquirer in the Philippines, and another from Ruchi Farrell with the Pacific Media Network, related to mutation of the virus and different strains that seem to be circulating now. So health authorities are reporting different strains of the virus. Do we know how many have been identified and what characteristics they have, whether they behave differently? Can it make them harder to control the virus's spread, especially in places like the Philippines where cases continue to rise? Over to you, Dr. Kasai.
Virus would continue to mutate while it's circulating. There are more than 70,000 gene sequence is available in the public database. And from that, we can see this virus is relatively stable. The mutations that questions raised here has been observed in January and received attention because laboratory data shows that potentially that can increase the transmission. And this database, which I have referred, observing the frequency of this substitute has been increasing, coming from all parts of the world. But so far, in the real life, we haven't seen any such evidence. And we're going to continue to monitor this sequence contributed from the researcher and institutes around the world. And then in case if there's any mutations that needs to pay attention, we definitely wanted to keep informed the public. But so far, what we've been seeing, those mutations is not require any changes of our recommendations, including a vaccine.
Thanks, Dr. Kasai. Next question is from Marianne Benitez with The Standard in Hong Kong. Given the latest studies that show children and youth are vulnerable to infections and can develop severe symptoms, how safe is it to have children resume classes as many countries are looking to do in the coming month or so? Dr. Matsui, could you speak to this one, please?
Thank you, Liv. Current findings show that children seem to be less affected of all reported cases globally. However, we should be cautious that those who are detected through surveillance system tend to have typical symptoms. We know that children need to go to school to have social interactions. And it's important for their psychosocial development. It's also an essential element of a functioning society. Decisions regarding how and when to open schools this pandemic is very challenging. They always involve risks and benefits for both public health and education. An important factor to consider is the level of community transmission of COVID-19. If there is ongoing large-scale community transmission it may be difficult to open schools because of the risk of outbreaks in schools. This is why WHO encourages decision makers to conduct transmission assessment using multi-source of information, so we know how much transmission is really occurring. If the school do open, we really have to do effective risk communication, especially among students, teachers, and administrators on how to prevent transmission at schools to follow related guidelines. And we need to upgrade knowledge about infections in children and what kind of measure they can take in schools. Thank you.
Thanks, Dr. Matsui. The next question that we have is from Jenny Ravello with DevEx. In your latest situation report, the Philippines accounts for more than half of COVID-19 cases in the Western Pacific region. Can all of this be attributed to increased testing and contact tracing, or are there areas where the response is lagging? To you, Dr. Kasai.
Thank you. I think how much Philippine case account for in the Western Pacific is not important. But what is important is that if these numbers are moving towards the directions to overwhelm the healthcare facilities. Philippines is a country who introduced a lockdown in the very early stage of this pandemic. I'm sure it prevented a significant number of infections and hence the number of people dying from there. And it prevented the healthcare facilities to be overwhelmed. But at the same time, I've been observing this virus and these interventions making a significant economic impact, and then they affect the people's life, particularly those people are in a poor setting and families and individuals. And I heard that the people are saying that we need to go out for the work. I totally understand that. The Philippine government has been putting a lot of effort to continuously improving their capacity. For example, I've seen their testing capacity has a significantly improved. And contact tracing, we've been advocating the need for contact tracing. I went down to the field and I've seen a wonderful model of the contact tracing, and now they're trying to expand that into everywhere in the nationwide. And I've seen also they're upgrading health services by increasing the number of the healthcare facilities, number of beds, and also establishing intermediate facilities. So far, we haven't really seen the number has overwhelmed the healthcare facilities. But when we see the positivity rate, the number that turns to be positive out of tested, or the number of people who is treated in the ICU has continuously increasing. So I think it's very important for the government to continue to improve this capacity, but also very important for government to continue to communicate to people, to encourage them to maintain their healthy behavior. The government yesterday eased the level of movement control, but I think it's very important for everybody to voluntarily do very similar things so that we can continue to suppress that level, not to overwhelm the healthcare facility in this country.
Thanks very much, Dr. Kasai. The next question that we have is from Teresa Montemayor with Philippine News Agency. What is known about asymptomatic cases, and why do some people just not seem to get sick? Another one for you, Dr. Kasai, I think.
This is a new virus, so we're continuously learning. But what we know so far is that they are asymptomatic. The person who doesn't show the symptoms at the time of laboratory diagnosis. And majority of them eventually develop the symptoms. But recent review noted that there are a percentage of the people continue to not showing the symptoms. The pool estimate is about 16%, ranges from 6% to 41%. The question is that whether those people who doesn't have a symptoms can transmit the virus to other people. This is very difficult to actually study. But from the available information, again, the modeling shows that these people who doesn't have symptoms can also contribute in driving the pandemic. So what is important is that everybody really pay attention and then take action as if you might get infections. So wearing a mask is one of those actions.
Thanks, Dr. Kasai. We have a question now from Alexei Zavrachev with TASS News Agency. Do you have information about vaccine development in Japan specifically, and the timing of trials and registration of the vaccines there? Another one for you, Dr. Escalante.
Yeah, thank you so much, Liv. Japan is working both on research and development and manufacturing of vaccines. So in the field of research and development, there is one vaccine candidate in Japan that is now on the stage 2 of clinical trial. And there are 4 others that are in the stage of preclinical studies or preclinical trial. In terms of manufacturing, there are at least two companies in Japan that are already discussing the transfer of technology to manufacture vaccines once they are approved from that are developed by R&D companies outside of Japan. We still do not have very specific information as to when the manufacturing and registration of these vaccines will happen. But I would like to mention at this point that in this region, the Western Pacific Regional Office has been putting together the national regulatory authorities of all countries in the region since January to prepare for countries to enable the regulatory mechanisms to allow the early entry of vaccines. And we are very pleased to inform that all the stringent regulatory authorities in the Western Pacific region, including Japan, Australia, China, Singapore, South Korea, and others, are willing to support the countries with lesser capacity in terms of vaccines assessment. So we will continue to do that, and we meet with all our NRA representatives on a monthly basis to provide and share the information across the countries. So WHO considers a safe and effective pandemic vaccine as a global public good, and therefore WHO will continue to urge and encourage the rapid, fair, and equitable access to any such vaccines worldwide. And we hope that the work that is ongoing in Japan and other countries in the region on research and development and manufacturing of vaccines will benefit equally the other countries in the Western Pacific.
You know Japan better than me.
Thank you, Dr. Escalante. The next question I'm going to give to you, Dr. Kasai, and it's also related to vaccines. It's from Marianne Benitez with The Standard in Hong Kong. What is the plan to make sure that all countries in the Western Pacific will have fair access to vaccines when they're available? Thank you.
Again, thank you for this important question. We see a vaccine as a global goods or global public health goods. It will not belong to one country, but should belongs to every countries. Unless every countries are protected, no countries is safe. And WHO, together with the partners, established initiatives called Access to COVID-19 to Accelerator. And one of the 4 pillars is about vaccine. We call it COVAX initiatives. This is initiatives to expedite the development so that people can have a volume that people can access the safe and effective vaccine. But not only that, this is the initiative to try to find a way to distribute those vaccine in safe and in a fair manner around the world. Saying is easy, but not that easy. And we're now working together with the countries around the world to find a way to make those pledges into action.
Thanks, Dr. Kasai. The next question that we have is from Renee Iosefa from TV1 in Samoa. What is the COVID-19 outlook for countries in the Pacific like Samoa? And what does WHO see as the major challenges in terms of being prepared for the virus reaching our shores? Dr. Kasai.
Well, thank you very much, Renee, connecting from Samoa to this press conference and sending the questions. Pacific is actually our priority in this COVID-19 response. In 1918, 1919, Spanish flu, Pacific island countries is the last to receive the virus, but had a most devastating impact. Of course, today is very different to Spanish flu period, but it's also important to continue to prepare and then respond to COVID-19. We have a country office in Apia, and we also set up a technical division in Fiji, closer to the Pacific Island countries, so that we can make effective technical support. But I myself, having a regular teleconference with the team in Apia, and what I've been observing is that government and also the people putting a lot of effort in preparing for this COVID-19. They had a very devastating measles outbreak, and then they responded very well. I think they are building on top of that. Our country's office is working very closely with the government and then the community in really making community engagement to prepare for this COVID-19. And government is also seeing this as a very important moment to upgrade their facility. So they're upgrading the healthcare facilities, hospital, but also the health centers. And then they actually upgrade their diagnostic capacity. So now they can diagnose COVID-19 within their countries. I'm very impressed with all those actions they're taking. Just recently, I noted that there were some rumors about the case of COVID-19. And I understand that the government is really investigating this case. And from there, what I pick up also the lesson is that what is important is that the people in Samoa should access to the right information and to take the right actions. And so I encourage also a government to continue to improve their communication capacity, and also people to try to access the right information.
Thanks, Dr. Kasai. The next question that we have is from Natalie Whiting with ABC News. She asks about Papua New Guinea. COVID-19 cases are on the rise in PNG. Are there concerns about increasing infections and potentially increased mortality linked to prevalence of other diseases like tuberculosis? Dr. Kasai.
Thank you very much again, also for these very important questions from Papua New Guinea. Papua New Guinea is also another priority countries for us because of the fragile health system. Currently, the number of cases is still small, but if we analyze those cases, there are significant proportions we don't know the link, and that is geographically scattered. So the government and us consider there is an ongoing community transmission. And then WHO and then the partners and governments are working very closely to deal with this issue. Now, the questions is about, while we're responding to COVID-19, what happened to other infectious diseases such as tuberculosis? It is so important to maintain tuberculosis, the services, essential services such as tuberculosis during the COVID-19. In Papua New Guinea, before COVID-19 occurred, we noted that the tuberculosis is a very important health challenge, particularly the drug resistance challenge. And again, we're addressing this issue together with the partners. And we continue to do so, even the COVID-19's response required. Otherwise, after the COVID-19, we might see a significant impact of coming from those diseases that requires essential services.
Thanks, Dr. Kasai. The next question that we have is from Salma Halik, again with the Straits Times. And we have a similar one from Cheng Por Aun with Voice of America in Cambodia. They're asking about travel and the resumption of travel within some parts of the region. They're asking about, for example, countries like Singapore that are keen to reopen economies and resume some travel, and also upcoming holidays for Cambodians this week. What is the risk of doing this with outbreaks in nearby countries such as the Philippines and others? Over to you, Dr. Kasai.
Thank you very much, Liv. Actually, this is also very important questions for us to bring economy back. And you mentioned about the risk. Exactly like other intervention, we have to approach this as a risk-based approach. So the basis is where people are traveling and what is the status of the outbreak in those countries, and what kind of people are coming or traveling, and what kind of control or intervention we can put in this country. And this requires continuous information sharing and an assessment, and eventually the dialogue between the countries. And so this is the area, number one, that countries need to continue to improve their surveillance system and share that information, and to be connected and have some dialogue and come up with agreement how to manage those who are traveling along beyond the border, and hope that we can bring those travels as early as possible, as much as possible. But again, important things is that we do that risk base.
Thanks, Dr. Kasai. The next question that we have is from Carolyn Bonquin with CNN Philippines. Is there an update on the research about reinfection? Is there conclusive evidence that a person who had COVID-19 before can get the virus again or not? Over to you, Dr. Escalante.
You want me to answer?
Or Dr. Kasai, that's also fine.
This is actually still an open question. At the earlier stage of this pandemic, we received a report from countries that there are a group of people who continue to be tested positive with the PCR, or there are people who once turned to be negative, but later we found it's positive. There are two elements on this. One is about the testing. We noted that people might continue to have a fragment of the virus. Fragment means the virus itself is no longer viable, meaning infectious, but we may continue to detect those fragments. In fact, that Korea did the intensive study if those persons who tend to be positive with the PCR, if this virus is viable or not, and answer was negative. The other element is about the people's immunity. Those who get infection, what proportion of the people can get the protections to prevent the second infection? How long that can continue? We still don't have any conclusive evidence, but we continue to gather information. So I'm afraid to these questions, the answer is that the question is still open. We try to connect the countries and then try to connect the researchers to continue to assess this information.
Thanks, Dr. Kasai. The next question that I have is from Bloomberg News. So the virus has been detected on imported food and packaging lately in China and New Zealand. And the resurgence in these two countries, some have speculated might have links with contaminated frozen food. What is WHO's assessment on the chances of the virus jumping from frozen foods like this to humans and infecting them? Is that something that you could speak to, Dr. Kasai?
Theoretically, it's possible. But so far, our observations or the evidence coming from the past 7 months epidemiology, it is unlikely. But I think it's important to continue to monitor so that we can rule out this possibility. The virus can, we know that the virus can survive in the surface, but we also know how to disinfect those viruses, and we have issued the guidance, and we continue to encourage people to follow that guidance and have some food safety practice.
Thank you, Dr. Kasai. We have a question regarding one of the slides that Dr. Matsui showed earlier from Rachel Thompson with Sky News Australia. She asks, regarding the slide that showed that in the Philippines and Japan, 60% of cases are aged under 40 years. Does this mean that the cases of the under 40s are actually increasing, or are countries just detecting those under 40 cases because of increased testing? I'm not sure whether Dr. Matsui, you would like to speak to that in the first instance? Or Dr. Kasai?
Hi, thank you, Lee, and thank you for the question. I think this is a combination of the spreading among the young population and also the changing of the improving of the detection of the cases among such kind of population. And it should be the combination of these situations.
Thank you.
A little bit supplement. As she said, I think there's many factors contributing to this. As she said, that there are testing capacity and then the opportunity to detect those age group, 20s, 30s, 40s, might be also increasing. But also there is a possibility that the past, the testing mechanism could pick up those who we could pick up, and then the chain of transmission also continue in the age group that we don't detect. And those are the age group that usually when even you get the infection, you might not develop the obvious symptoms that push you to go to the testing. And of course, there's a possibility that the continuous importations would start the chain of transmission. But what is important is that we should recognize these are the age group who is active, but also when even you get the infection, you might not notice. So potentially becomes an important driving force of the pandemic. And it's important that all those people pay attention not to infect the others.
Thank you both for those responses. We have a couple of questions, and I think this is the last that we'll have time for within the hour, around kind of reliance on vaccines as the possible solution, especially for countries where the context is such that physical distancing can be very challenging. What would you say are the risks of countries such as this being overly reliant on the sort of silver bullet of a vaccine that we don't actually have yet and we don't know how effective it will be? Dr. Kasai, would you like to kick us off on that?
Right. When we talk about vaccine, my position is on one hand, very optimistic, but on one hand, very cautious. Optimistic because I've been so impressed by the speed of development, as my colleague, Dr. Escalante mentioned. But I'm also cautious because even they can really manage and then develop safe and effective vaccine, the production capacity would not really meet the demand coming from entire world. So I think what is important is that we continue to improve our response and not just hope for the vaccine.
Thank you so much, Dr. Kasai, but also Dr. Escalante and Dr. Matsui for your time this morning. And thank you very much to all of the journalists that we had from around the region and beyond connecting this morning. Some really fantastic questions, and we appreciate the opportunity to provide these updates to you on the current situation and the actions to respond to them. We look forward to updating you again soon. Thank you.
Thank you.